it was always said, you can't measure the amount of people who don't get sick. So how do we quantify what we do? And then the CDC came out with the associated causes of things that are related to the occurrence of foodborne illness. FDA coined the term risk factors.
There's a lot of connections between the Retail Program Standards and public health.
When you're using the FDA food code and the FDA food inspection form, it focuses not on floors, walls, and ceilings. It really takes the foodborne risk factors and focuses on what's going to make somebody sick.
So that's going to hopefully lead to reduced risk factors and reduced core items that could lead to those foodborne illness risk factors so that we can see that reduction in incidence in our community.
One thing we were trying to bridge with this is, as we know, working with this type of industry, they're mainly a visual and oral type culture. So they don't always translate very well to how we typically operate business, where we're actually looking at codes.
In our program, we're using the Retail Program Standards to continuously improve our program. So as we're continuously improving our program, providing staff with better training opportunities, we're going to see a direct benefit to public health because they're able to apply everything that they're learning out in the field with the operators to help them improve the safety of their businesses and the food that they're serving to the public.
I personally like to think of myself as an educator and not so much as an inspector. I mean, of course, I still look at the inspection part of it, but I also want them to feel comfortable to know that I am educating them as well.
If you're conducting the risk factor study, the advice I would give you is to make sure you plan ahead.
Really, the prep is very important on the front end, making sure that you have everything in line, clear direction of what you're going to be doing.
I would also recommend establishing a written procedure before conducting the survey, and then so that you have a record of what the approach, the methods, how things were done in the future as you look back on this, because really the intent is to do within the risk factor study multiple surveys over time, and so it serves to help refresh the memory on how things were done historically.
And make sure that you're training your collectors so that they know what they're doing when they're out there and it's being done consistently.
I would recommend that you have your FDA retail specialist do a training for the staff members that you identify are going to be the data collectors so that they can all get the same exact training. They can sit in the same room, ask questions, and then go forward and do a data collection so that you can get better data, more timely data, have it all collected within the same period of a shorter amount of time, and hopefully get a better risk factor study out of it so that you can see what the true areas of improvement in your community are.
Lastly, if it's possible for you to be able to do it outside of a regulatory visit, we got operators to respond to our questions much more freely if we weren't doing it as a regulatory visit. So we explained to them that it wasn't part of their regulatory visit, that they weren't going to get a grade, and then they were much more open about their answers to a lot of questions.
So we really use the results of this risk factor study to guide everything we do, a lot of what we do. It provides metrics to show where we can apply some pressure to have a greater outcome on the lowering of illness across the United States. It shows where internally we can place our resources. We're developing our own work groups on intervention strategies to take the next step with what we've been seeing in the data that we've gotten. Whatever the risk factor that might be out of compliance, what can we do as the FDA? Can we provide more resources, some fact sheets, more science? Can we help industry? Is a change needed in the food code? There's lots of different ideas and concepts we're brainstorming to come up with on how to improve things and improve our services. So it's had a large impact. It's our main metric for measuring, the status of public health and what our impact is on it across the U.S.